do we drink too much? A new government report actually suggests that this country may have a serious drinking problem, and it recommends that doctors and health workers get more aggressive with you and me to get us back on a better track. Earlier, I had a chance to speak with one of our favorite docs to get her thoughts on this new study. Dr. Jennifer Caudle joining me from Philadelphia. So drinking is so ingrained in the American experience, as we know, right? We drink it to celebrate, tailgate. It's ingrained in many of our holidays. It seems simple, but how does someone know, Doc, that they're overdoing it?
Well, it might be surprising to find out, but 38 million adults overdo it, and overdo it quite often. Overdoing it, according to the CDC, is when men have more than 15 or more drinks per week, and women have more than 8 or more drinks per week. And that's really what we define it as overdoing it. I want to contrast this with what we consider moderate alcohol intake, which is okay to drink moderately. Moderate alcohol intake is for women no more than 1 drink per day, and for men no more than 2 drinks per day. So I think it's really important to be aware of exactly what the numbers mean and how much exactly is too much.
So the study says that only 1 in 6 people actually talk to their doctor about drinking. I mean, think about when you have to fill out on the paperwork. We were talking about this in the newsroom. How many drinks do you have a day? You know, people go, 1 or 2, but it's actually a lot more than that.
Right.
So what does the CDC think that doctors can do about the fact that they don't want to talk about it, and also that they're not always honest?
Right. Well, you know, I think this is actually a two-way street. So you're right. Only 1 in 6 people talk with their doctor about their alcohol use. You know, something I have to say, actually, you talk about filling out the paper in the waiting room, and, you know, in medical school, one of the things we're taught is that whatever a patient tells you in terms of how much they drink, you need to multiply that because chances are it's higher. You know, the issue goes both ways. Patients, you need to talk to your doctors about your drinking. But as physicians, we need to start asking the questions. And one of the reasons why is that the CDC has found that when doctors and healthcare professionals screen and counsel patients on alcohol use, it can actually decrease the alcohol use by 25% on a single occasion. So that really is quite dramatic and really can help. And don't forget, alcohol overuse can be harmful. We're talking about fetal alcohol problems in terms of children, motor vehicle accidents, drinking too much can lead to heart disease. So there's many reasons why this really should be discussed between patients and physicians.
Now, as you mentioned, 38 million Americans drink too much. And, you know, that costs the American economy about $250 billion when you crunch the numbers. So how well do these treatment programs work with heavy drinkers?
They can work quite well. They really do. They can work quite well. You know, there's a lot of variables that go into how well a treatment program is going to work for a patient when we're talking about things like alcohol abuse. A lot of it has to do with the patient. Are they ready to change their ways, to quit drinking, to cut back? What type of support and resources are there? Of course, the types of programs that are there. But really the most important thing is to talk with your doctor, your healthcare provider, about what your habits are. Physicians, I encourage all of us to start asking our patients and really having an honest conversation. There are real risks to drinking too much. There are real problems, but this can be affected positively if we have open and honest conversations about it. So there are many treatment programs out there. I really want to encourage anyone out there who thinks they might need help to get help.
Dr. Jennifer Caudle, thanks for the insight.
Thanks so much.
And if you or someone you care about appears to have a problem with alcohol, the U.S. Department of Health and Human Services actually has a toll-free number. It's 1-800-662-HELP. It's a confidential call, and you can speak to someone who can help you out.